So thank you everyone for joining the meeting today, and I hope you leave here learning a little bit more about dementia and things that you can do to help reduce your risk of dementia. Just before we get started, a few housekeeping items. Be sure to mute yourself so that we cut down on background noises. I believe everybody is muted at this point. If you haven't completed the pre-test, the link is in the chat box. And the training, this is a supplement to existing training or information that you have learned. By no means do we ever want you to change the way you are doing something before you speak with your supervisor, or it's just some informational knowledge if you're not someone who's working within the field. So what we're going to go over today is some dementia education. We're going to talk about some statistics, both nationally and within Tennessee, some effective communication techniques, and then resources that might be available for a care partner or a person living with dementia or someone who's working with those that may be either a care partner or living with dementia. They're going to have a chance to do some questions at the end. If you have a question and you're afraid you'll forget it, just type it in the chat box and I'll try to keep an eye on it and we'll come back to it and we'll definitely try to get everything answered before we're done. So we're going to get started here first with what is dementia. So you often hear Alzheimer's disease and dementia used interchangeably, but Alzheimer's is actually a type of dementia. So it's more than just Alzheimer's. Dementia is a set of observable symptoms, specifically problems carrying out activities of daily living. So driving, balancing a checkbook, taking care of somebody, taking care of yourself, cooking a meal. And it also affects your cognitive abilities and your memory. So people are not just becoming forgetful, they are experiencing an actual biological change within their brain. So while forgetting things and being forgetful might be a part of normal aging, dementia goes beyond those normal parts of aging. And I say normal in air quotes because it's all relative. So 5 A's of dementia. So these are very helpful to just try to think of if you're maybe questioning if someone you know has dementia, or if you have a concern, this may be some things that you can kind of mentally check off and be like, okay, maybe we need to talk to a doctor. So the first one is amnesia. So it is difficulty with memory, particularly short-term memory. So if you haven't seen the Pixar movie Inside Out, I highly encourage you to watch it because it talks about memory and how we load memory and store memory, and you have core memory. But you also have a difficulty converting a short-term memory to a long-term memory. So that's why a lot of times people who have dementia may remember things that happened when they were younger, but they can't remember what happened just a few minutes ago. It's that object of creating that short-term memory and transitioning it into a long-term memory. The long-term memories are still there. They just don't have the ability to convert short-term to long-term anymore. So that's called amnesia. The second A is called aphasia. So it is a language disorder where the ability to comprehend language and the ability to formulate language or words become diminished. So a lot of times you hear the word aphasia related to someone who may have had a stroke. So they may temporarily have paralysis on one side of their mouth, or they have memory recall issues. I know when my grandmother had her stroke, she had a brief moment of memory recall. She understood what we were trying to tell her, but she just couldn't think of the words. After she worked with a therapist, that came back. She was doing well. So a lot of times those that have dementia, this aphasia phase doesn't correct itself. So that, there's that language disorder. The third A is called apraxia, which this is the inability to perform motor skills and sequence actions. Again, you think more of maybe buttoning a shirt, or most people would put on their pants and then put on their socks. Some people may do the opposite. Some people may do their socks first and then their pants, but doing things in a sequence. Again, those fine motor skills And this is within the absence of a physical disability. So again, if they've had a stroke, they may have some apraxia, but this would just be outside of something else that could have caused it. The fourth one is called agnosia, which is the inability to recognize objects for what they are or they're used for, or the ability to recognize people. So again, think about, I know my grandmother, I'm going to refer to her a lot in this because she had some dementia. So that is my first world experience. So she is my example that I use a lot. But she would sometimes look at the remote control and think it was the phone. So she didn't recognize the object for what it was to be used for. And again, they might not recognize people, or if they say a lot of times, I want to go home, and they are home. So recognizing their environment. So that's what that one is. And then the last one is called attention. So difficulty concentrating on things, or they need more assistance with walking and getting from one place to another. You might notice a lot of weight loss because they cannot focus on concentrating to complete a meal. So they may have a couple of bites and they think, okay, well, I'm done. But you don't have to remind them, cue them to continue eating or take their medicine or something like that. So these are just kind of some high points to think about. Again, we're going to get into a few more specifics later on, but those are some things to keep in mind in case you might notice something with someone, a loved one, or a family member. So now we're going to talk about the types of dementia. Like I said, I mentioned that Alzheimer's is the most common. It is actually the number one type of dementia that there is out there, which is why most people interchange Alzheimer's and dementia. But dementia is an umbrella term. So there are several types of dementia that fall under that umbrella, and we're going to go through each one of those. So outside of Alzheimer's, you have vascular dementia. So it's caused by changes in the cardiovascular system. So heart disease and high blood pressure, they can lead to a stroke and blood vessel changes with not only within your heart, but also in your brain. So having heart disease or high blood pressure, it can limit the blood flow throughout the body, including your brain. So that's why it's so important to know your numbers. So blood pressure is the force of blood that is pushed through the arteries. And if your blood pressure is too high or too low, it can become problematic for the brain. So there could be, if there's a history of heart disease or uncontrolled blood pressures, those could eventually lead to vascular dementia. Again, it's not to say if you have high blood pressure that you're automatically going to get dementia. If you can manage your high blood pressure, that's always important, not only for your brain, but also for the rest of your body. So again, knowing your numbers and keeping a watch on those things is really important as you age, to make sure you can try to prevent it from getting worse. The next one is called Lewy body dementia. Lewy bodies are masses of cells that build up and cause blockages or a disconnection of nerves. So it's actually a blockage that is happening and causing a breakdown within the nerves, or a blockage. So maybe there's a bridge that connects two parts of the brain. Maybe that bridge is blocked. So think of it like a river. There's a blockage in there, and it can't go through. So that can cause the disconnection to happen with the nerves. And it also can cause hallucinations. So a lot of people who have Lewy body dementia suffer from hallucinations. So again, it's more than just something's wrong. There's physical changes that are happening within the brain. And where you can look at your skin, if you cut it and you can see the cut, you see the bleeding, you see it healing. In the brain, we can't see that. So they're not being difficult. There's just a lot going on that you may not be able to see. The next one is called frontal temporal lobular dementia, or FTD. And this affects the frontal and temporal lobes of the brain. So this is where your mood is, your agitation, different things like that. So if you notice someone and they start having uncharacteristic mood swings, they get agitated more easily, they're more emotional. This could be something going on in the frontal temporal lobular part of the brain. And then there's one that's called Parkinson's dementia. So it's really similar to Lewy bodies, but this comes in with Parkinson's. So if someone develops Parkinson's, they are more likely to develop Parkinson's dementia. And again, this can have some existence of the Lewy bodies, so with the hallucinations and things like that. Again, not to say everyone who has Parkinson's is going to get dementia. It's just they're more likely to have it. And then there's one called mixed dementia. So there could be someone out there who has a lot of these symptoms that could be coming from different sources. So again, this is why it's so hard to get a diagnosis and receive a diagnosis and know exactly what's going on, because it can all intertwine and mix, and the symptoms can be shared across different types of dementia. And a lot of times people are not actually diagnosed until after they have passed and their brain can be studied more. So again, that's why it's really good to pay attention to what's going on with your loved ones, those you know in your family, so you can start asking these questions earlier on and know if this is something we're getting into. So now we're going to talk about Alzheimer's for just a second, since it is the most common. It accounts for 60 to 80% of all dementia cases. The brain changes are called plaques and tangles within the brain, and they can lead to nerve cell and brain cell death. And this can start happening up to 20 years before someone is ever diagnosed. So early onset Alzheimer's, it can begin as early as someone's 40s. So just start thinking about it. If you're diagnosed with early onset Alzheimer's in your 40s, those changes in your brain started happening in their 20s. So again, this is not something that's just affecting older adults. It can affect younger adults as well. And because of that, a lot of research is being done with younger populations as well as the older populations to try to figure out some different ways to target it and different ways to treat it. So we're going to look at the pictures below. So if you look at the picture that's on the far left, it's nice and pink and plump, and the creases within the brain are really close together, and there's not a lot of gaps, and it just looks very healthy. So this is a brain, what a normal brain would look like without any kind of disease. And then if you look at the picture in the middle, you notice it's a lot darker. It doesn't look quite as healthy. It doesn't look quite as full. You notice the spaces in the parts of the brain are wider. So they're more, it's more cavernous, like a cave or something like that, where it's fell in. So this is a brain with advanced Alzheimer's. So again, we're not talking about like early onset. We're talking about super advanced Alzheimer's. And then if you look at the last picture on the far right, you can see the two brains have overlapped. So this is how they would compare. The lighter shadow in the back is the healthy brain. The smaller brain on top is the advanced Alzheimer's brain. So it physically causes shrinkage of the brain. So it is, again, these changes are happening, and it's not something you can look at somebody and see, but there are actual physical changes that are happening with inside the brain. And that's why it's hard to diagnose. Changes may begin with memory loss, but over time it starts affecting someone's talking and walking and their ability to manage their daily activities. So we're going to talk about some brain health risks. There's a lot of things that can affect your brain, and you see them listed here on the screen: accidents, alcohol, smoking. We're going to go through some of them. We're going to talk about what we can change and what we can't change. And we're just going to look into this to try to walk away with some things that maybe little changes we can make in our lives to affect our risk of dementia. So age and genetics. As you get older, the brain can build up, like I said, those biological changes. And then genetics are things that are inherited from your family that are passed down. Those are things we cannot change. You can't help who your family is. You can't help the genes that are in your body. And then diagnosis of a mild cognitive impairment. If you've ever had a doctor tell you you have mild cognitive impairment, the likelihood of you developing Alzheimer's or dementia is very high. Again, that's something you can't change. Those are genetics. Those are things that you may be predisposed to that have no change whatsoever. So let's talk about what we can control and what we can change. So traumatic brain injuries, again, if you saw, remember on the other screen, it said accidents. Injuries to your brain are more likely to result in a diagnosis of dementia. So that's why there's a lot of research and things being done around sports, particularly football. You hear about people getting concussions, having multiple concussions. So that's a contusion to the brain. So it's a bruise. So when you bruise your arm, you see it gets dark, it changes, it hurts, it's sore, and maybe that spot's a little more tender. Concussions or traumatic brain injuries are bruises to the brain. So they affect the tissue of the brain. So multiple ones of those can cause you to have multiple memory issues because you're actually physically damaging the brain. So that's why they talk about the helmets and different things within sports and brain injuries and things like that to try to, if you can avoid a brain injury, obviously that's the best. And now if you're in a car wreck and you get a concussion, obviously that's something you couldn't have avoided. But if there's certain things that you can do to limit your exposure, that's always better. Maintaining a good diet and exercise, not only does it make you feel better, but it keeps your brain younger. And we're going to get into some specifics on how diet and exercise can affect your brain. Maintaining your diabetes, high blood pressure, and depression. Again, managing these can reduce your risk of dementia. Again, like I said, high blood pressure specifically, there was a study that was done that showed it compared people who have high blood pressure and it's uncontrolled and those who do not have high blood pressure and their risk of dementia. The ones who have high blood pressure and keep it managed, they're at the same risk level of someone who doesn't have high blood pressure at all. So again, knowing your numbers, knowing what triggers your blood pressure, knowing what triggers your stress levels, your depression, your anxiety, different things like that, and keeping that under control will help your brain stay healthier longer. And then obviously smoking and alcohol, we know how those can affect us. Again, we're going to get into some specifics of how it directly affects the brain. So it's important to manage the things that you can, especially if you're a care partner for someone caring, a care partner for someone who's living with a diagnosis. Your health is just as important as that person. So as there's no way to truly prevent you from getting diagnosed with dementia, but the more that you can do to reduce your risk, the better off we are. So how do you know if memory loss is serious? Here's some little specific signs that are just more than just forgetting your keys. So managing your finances. We're going to start with the pink one, difficulty managing your finances. So this is more than just forgetting to pay a bill. We all have those moments where we're like, did I pay that water bill or not? And then you have to go back and look. That's typically stress and you have a lot going on in your lives. We all have families, we have jobs, we have different things going on. So there's going to be things that you're going to forget. But this is taking that to the next step. This is inability to manage a budget. This is continual forgetting of paying a bill. This is not realizing that you have to pay your water or light bill every month to keep your water and electricity on. So it's a little bit further than just that one-off forgetting to pay a bill. So we're going to go to the middle one, loss of judgment. So you have difficulty making decisions. You can no longer determine if an activity is safe or not. So think about if you know someone who may be living with a diagnosis, maybe they don't understand that if you touch the stove, it's hot. So those decision-making and judgment-making things they no longer exist. They don't understand that you can't just walk out in the middle of the street. You have to stay on the sidewalk. Different things like that. So just having that loss of judgment and determining whether you can be safe or not. The next one is confusion on time. Again, this is not just forgetting what time it is. I mean, I do that all the time. I'm always looking, what's today's date? I have a coworker that sits close to me and I'll say, today's the 27th, right? And she's like, yes. So that's just daily activities that happen. This is more about getting nights and days mixed up. So if you tell somebody it's 7, they may think it's 7 at night versus 7 in the morning. So they're getting ready for bed, or vice versa. They think it's 7 in the morning. So they're like, well, we have to go to work or we have to get to church. So it's that actual not being able to distinguish the time or place or date. So again, it's more than just an occasional forgetting every once in a while. Changes in memory loss that affects your daily life. So it's things that physically impact how you carry out your day. So maybe you forget how to get to work, or you don't know the way. It's something you've always done, but now you no longer can get there. You have changes in visual and spatial awareness. You can't tell how far something is away. So that's a lot of people may have issues. You might notice they're not as safe driving because they can't judge the distance between them and the car in front of them. Maybe they have more frequent falls because they're trying to go down the steps, and that visual and spatial awareness is not there anymore. It's also really important if you have someone who is living with a diagnosis to try to keep things in the places that they remember. So try not to move furniture around a lot. Try not to change things up because they have the long-term memory of how it's always been, and you start changing things, they may fall or they may not notice how far they are away from something anymore. Looking at something and not recognizing what it's for. Again, maybe they look at the phone and they don't know what the phone's used for, or they think that it's the remote control or vice versa or something like that. So it physically interferes with their activities of daily living. And then the last one is moods and changes in personality. So someone that you may know that's always lighthearted and fun and kind, and now they've become more aggressive, they're more hateful. It's something you might label as out of character. Again, that's something where it may be a little bit more serious than just a mood swing or something like that. So it's just, these are little things to keep in mind. If you start noticing these things, you can start talking to the doctor sooner, making them aware of it so things can be monitored and watched, and maybe changes can happen a little quicker than they might have if you didn't know about these things. So now we're going to talk about the stages of dementia. So there's 7 total stages. You can see them on the screen. 1 is no cognitive, so it's just normal, where everybody would start off. Again, I say normal relatively. So dementia is generally classified into 3 main stages. You have early, moderate, and late. But there's 7 overall. So we're just going to kind of go through these a little bit and see some of the differences in these. So maybe you can recognize or maybe there's someone you recognize that might have some of these. So early stages, we're looking at the 2 and 3. So right here about very mild cognitive decline and mild cognitive. So we're in this stage is our early stages. Someone in their early stage, they may still live at home. They may still live alone. They just might need a little bit of assistance, maybe have some memory loss. It's not a huge impact to their daily life. It's just they're starting to have a few changes. So family and friends may need to check on them a little more often. Maybe start considering giving up the keys because we're still in that early stage where it's not 100% dangerous for them to drive, but it's starting to get there. We noticing some changes. So we need to start looking at some changes we need to make within the environment to keep them safe. So next, we're going to talk about moderate stage. So we're here at stage 4 and stage 5. So they're becoming a little less independent. They may have to move in with a family member or a child. Their safety is starting to become a concern, especially when it comes to operating a vehicle. Their personality and behavior begins to change some, and you might notice them getting lost more often. So maybe somebody that normally takes a walk every afternoon in the neighborhood, maybe they get turned around and they forget how to get back home. So you just start seeing some more changes that are starting to affect their daily life. Issues with time and date are starting to become more often or happening more often. So it's getting a little worse, and we're starting to need some more assistance than just being at home by ourselves or someone checking in. They also in this stage they have poor awareness of their lower half. So this is where they might start having difficulty walking. Maybe they need to start using a walker or another assisted device. They're a little more unstable. They have more falls happening, different things. So this is, we're progressing a little bit more into some significant changes that are happening. So then late stages, we're sitting here, we're looking at stage 6 and 7. They're beginning to experience more physical problems. So this is the result of the brain dying and shrinking. So if you think back to the pictures that we looked at, this is where the brain shrinkage begins to occur. So they need more help with their activities of daily living. And the assistance may go beyond what the scope of what a family care partner or a friend may be able to provide. They may need to start looking into an assisted living or a memory care unit or something like that, because they need some more professional intervention and help. You may notice that they're starting to withdraw and not talk as much. So they begin to give nonverbal cues and communication. Maybe they're more sensitive to pain, lighting, different things like that. So it's really progressed to the point where things are happening more that affects their daily life, and we have to get some more hands-on help. They process things slower. There becomes a type of tunnel vision with someone in these late stages of dementia. So where their peripheral vision may not be functioning as well. So you need to be directly in front of them when you're speaking to them or when you're trying to help them or ask them to do an activity. Like I said, home health and assisted livings come into play at these stages. Keep in mind that the stages can go in and out. So to classify somebody as, oh, they're in the moderate stage, that may be where they're at that day. But then the next day it may change a little bit and they're a little more into the early stages, especially if they're on the cusp of those stages and changing. Again, this is why it makes it so difficult to diagnose Alzheimer's or dementia, because things can just come in and out. That's the joy and the curse of the brain. It is a amazing organ that we all have, but it is ever changing and it makes things more difficult to diagnose. So that's why it can get frustrating for care partners, because they can't get the help they need. So again, knowing these things and noticing these things may help you in the long run to start talking to your physicians a little sooner. So treatments. We've told you about all of this stuff that's happening. How can we treat it? In June of 2021, there was a drug for the treatment of Alzheimer's that was approved by the FDA. It is not a curative therapy, and some patients could take it for multiple years before they ever notice a difference. It's called Aduhelm, and I believe that's how you say it. I'm not a nurse, so hopefully I said that right. Although it's approved by the FDA, it has been controversial in terms of its effectiveness and safety. It's also very controversial for the price. It is a drug that has to be administered intravenously. So a physician has to do it. It has to be done in a clinic setting. And the price can range about $28,000 to $30,000 a year for the drug. And I don't know about y'all, but I don't have that type of money to laying around that I can just do for a treatment that may or may not help. So a lot of health systems have said that, like Johns Hopkins and things like that, are saying we're not going to administer this drug because we have concerns about its safety and its effectiveness. In 2021, there were some human trials that began for a vaccine designed to slow the progression of Alzheimer's. There are currently over 140 Alzheimer's drugs in the pipeline, so, that are out there being worked on. 4 out of 5 drugs in the pipeline are hopefully disease-modifying therapies. So researchers just need more participants to do clinical trials in the search for these Alzheimer's treatments. So there are things that they are working on, but right now there is no, like, we can take a pill to help lower our blood pressure. We can do insulin to help us with our diabetes. That's just not out there right now for Alzheimer's, which is frustrating for care partners. So there is hope, but there's never a guarantee. So we need to look at improving the quality of life for someone who is living with this diagnosis and their care partners. So some therapies that may help, again, it's not going to cure it, but it may help slow it down a little bit. You have occupational therapy. So that's with your dexterity and your activities of daily living. So that's helping keeping those muscles ready for bathing and dressing and different things like that, preparing meals. We have environmental modifications, making walking and living a little easier. So again, pick up rugs if they might be a trip hazard, make sure cords are secured, things like that. It's easier for somebody to maneuver around their home. Making things easier and maintaining a routine. So instead of just, if you are helping someone who's living with a diagnosis, instead of looking at them and saying, okay, it's time to get ready, they might not understand what get ready is. Again, those putting things in sequential order is a little difficult. So maybe we have to break it down into smaller tasks and say, okay, let's brush our teeth. Okay, now let's put our socks on. Now let's put our shoes on. So you may have to break it down into smaller tasks and keep a routine every day. This is how we do it. Again, it's just going to keep them happier. It's going to help them kind of stay in that routine to know what they need to do instead of changing things up and making it more difficult. It's also going to limit their agitation because they don't necessarily remember the routine, but it's just, it keeps them knowing things are happening in the same order every time. Therapies help improve quality of life, especially music therapy. It can help take them back to a place in time where they had a lot of joy. So again, those long-term memories are still in there. We just got to access them. So if you play a familiar song, or it'll take them back to a time maybe in their childhood when they were happy and they weren't sick, and they have those memories associated with that song. I know just me currently, if I hear a song that I heard when I was a kid, I think about where I was when I heard that song the first time, what was going on in my life and different things. And it can bring happiness and joy, or it can be sadness. So you want to try to make sure that you have those songs that evoke happiness and keep them, calm them down a little bit more. So especially during, if you're having bath time or anything like that, they might get agitated. So having some music might help keep them calm, reduce that agitation. Pet therapy and art therapy both work similarly. Sometimes it's just comforting to have a pet in your lap. There are things out there now that are robotic pets. So maybe we don't want to get a real pet because that's more that a care partner will have to take care of. But they have robotic pets that move and you can pet them. And I know they have some cats that I've seen that purr. So, it's something you might look at. Again, if it's something that's going to keep them calm, we might need to try to do anything we can. So good overall health is going to help maintain good brain health. So again, we're going to talk about some of these things we're going to strive for and talk about how it's going to affect our brains. So the top 10 list of prevention: sleep hygiene. People underestimate the importance of sufficient and regular sleep. Sleep enables your brain to recover and repair itself from your day. It's recommended to get 6 to 8 hours of sleep a night. People who sleep too little are at a greater risk of Alzheimer's disease and related dementia. Again, just like when you rest your body at night, you're also resting your brain. So if you're not getting good and sufficient sleep, your brain doesn't have time to recover from your day. Diet and exercise. Your brain uses 10 times more energy than normal tissue in your body, so it needs a large amounts of nutrients to function properly. Eating well will make you feel better. It's going to make you think better, and you're going to stay better longer. In fact, nutrition is the best technology that we have to reduce the risk of Alzheimer's disease and related dementia. So eating a healthy diet, think of your blue fruit and your red fruit, especially your blues. So like your blueberries, blackberries, things like that. They have a lot of antioxidants in them that help your brain. So eat more blueberries, eat more berries in general. Herbs, the powerful health benefits of herbs should never be underestimated. We're talking about oregano, rosemary, ginger, turmeric, garlic, different things like that. So those help reduce inflammation. You have inflammation in your body, you have inflammation in your brain. The inflammation in your brain can cause damage, so therefore eating healthier and keeping that inflammation down is better. Green leafy vegetables, we all know that those are healthy for us. So kale, cabbage, broccoli, spinach, sprouts, things like that. I'm not a huge fan of green leafy vegetables, but clearly they're important. So maybe mix it with something else, but just to get it in there. Your omega-3 fatty acids, they're important for your health, especially for your heart and eyes. And these are thinking like your fatty fish, salmon, herring, anchovies, mackerel. If you don't like fish, there are plant-based ways to get your omega-3 fatty acids. So you're looking at walnuts, chia seeds, flax seeds, things like that. Again, you might not want to eat them by themselves, but mix them in with some yogurt or something like that. So there's just a lot of different things that you can do to help reduce your sugar intake. Again, those are your super starchy items. Sugar damages the brain and increases inflammation. So starchy foods process as sugar. So if you reduce those starchy foods, you reduce that sugar. Whatever you eat, your brain has to digest it. So if you're eating before bedtime, your brain cannot rest because it has to process the food. So finish eating about 4 hours before bedtime to give your body time to digest the food. Your brain can digest it, and then your brain can rest. Exercise, both physical exercise and cognitive exercise. So think of walking, just moving. It's never too late. Our bodies were literally made to move. So keeping active, keeping going. And then with cognitive exercise, think of your brain likes to be challenged. So it's like a muscle. Read a book, solve a puzzle, play a brain game, learn a new language, learn a new hobby, become a volunteer, learn how to play an instrument, learn to dance, paint, draw, something like that. Learn something new. Always keep your mind active and going. Here at work, we do little brain teasers in the mornings. Sometimes we play games at lunch. We do puzzles and different things on our lunch breaks just to kind of break up the daily activities, but it also challenges us to do different things and keep our brains active. Be social. People need other people to feel happy. So we're social animals. So seeing people keeps your brain young, especially if we're coming out of this couple of years of COVID where we were so isolated. Get back out there, get social, get involved with your senior centers, get involved with different activities, your church, your group, your friend groups, different things like that. Be social, be active. Your brain likes to be involved with other people. Boosting your mood. So a happy brain is a healthy brain. Your stress damages your brain. So practice positive thinking. Maybe you need to write on your mirror every morning positive affirmations. That's okay. Do that. Be happy. Avoid stress. No, that's easy to say because stress comes in all different forms. But just try your best to stay positive and remain happy. Again, smoking, maintaining a healthy weight, and limiting alcohol. We all know what all of these can do to our bodies. Again, our brain has to digest whatever we put into our body, just like our stomach and stuff does. So again, keeping those things healthy and staying active will help keep your brain young. Even though we're healthy, changes in memory are going to happen. So it's not to say that if we do all of this stuff, we're not going to have changes. That is there is a normal part of aging that's going to happen just as our bodies slow down as we get older, our joints start to hurt a little bit more. We're going to naturally have some challenges in our memory. Again, multitasking may become where, if you're younger, you could watch TV and read a book at the same time and know what was happening. As you get older, you may have to focus on one over the other. Sometimes you might have difficulty finding the right word. I do that a lot. I have to stop and think of what word I'm trying to do. And that's just because it's a constant, I'm constantly moving, constantly going. So that's not to say, oh my goodness, I have dementia. You are going to have some different changes in our bodies. And then a decrease in your ability to pay attention. Maybe you could sit through a lecture and not have any problems, but even through this 45 minutes we've been on this webinar, you're like, all right, I need something else to do. I can't focus. I can't concentrate. Again, that's just natural. That's going to happen. So don't be discouraged. You are going to see some changes in your memory, but again, doing everything that you can to prevent Alzheimer's and dementia is what we need to do. Regardless of your age, there are things you can do. Like I said, like we talked about, exercise, learning a new language, doing a brain game, moving. Just get up and walk for 10 minutes at a time, if that's what you need to do. Any kind of movement and activity that can keep your body moving, keeps your brain engaged, keeps your body engaged, helps you as you age. So anything that you can do, regardless of how old you are, just that will help you live a little bit longer. So we just talked about all of these things that you need to do. So it's going to be difficult to figure out, all right, where do I stop? Or where do I start? Start with one thing at a time. First thing should be schedule a visit with your doctor. Get a physical. Know your numbers. Figure out what's going on with your body. If you're a Medicare beneficiary, they get free annual wellness visits once a year. So make sure you get your wellness visits in. Make sure you get a physical done. Just knowing where you're at, knowing what your weight is, knowing what your blood pressure is, knowing what your insulin and sugar level is, just knowing knowing that information, you can start making small changes. Take your list of medications to your doctor when you go. Find out, hey, are any of these contradicting each other? Are they not working because I'm taking this one? What is there anything we can cut out so I'm not taking as many medications? Just add, if you may not like vegetables, you don't like kale or spinach, just try to add one thing. And again, mix it in with something else. You don't have to eat it raw. Now don't mix it in with like sugar and butter, but try to mix it in with yogurt or put some chia seeds in your morning smoothie. You're never going to taste them. They're going to blend up, but you're still going to get the benefits from them. Keep a journal, an activity journal, a food journal, health journal, just to kind of know what's going on with your body, know your routines. And if you do it for a week, and if you notice something where you can make some improvements, start making those improvements. It doesn't have to be everything at one time. It can be little bitty things at a time. Go to your local community center, go to the gym, your church, a senior center, something like that. Get active, stay active, be social, be around people. Again, our brain likes to be social and be active. So again, one small change can affect things down the road. So now we've talked about dementia education. What is it? How can we prevent it? What can we do? Now we're going to briefly touch on some statistics just to kind of show you where we are nationally and within Tennessee when it comes to dementia. Alzheimer's disease and related dementia, it's the number 6 cause of death in the U.S. So nationally, it is the number 6 cause of death. It kills more than breast cancer and prostate cancer combined. So again, this is more than just a small thing. This is affecting a lot of people. During COVID, Alzheimer's and dementia deaths increased by 16%. Again, a lot of this was likely due to isolation. People weren't around people. Again, we need to be social. We need to be active. And also because especially older adults were isolated from people, no one noticed that they were having all of these changes and things were happening. Maybe there was a fall that happened because of dementia or Alzheimer's, but nobody knew it. And, so that led to other things. So it was just that. Again, that's why we need to get back out and be social and be around people and interact with people. In 2021, Alzheimer's disease and related dementia cost the nation $355 billion. That's with a B. And by 2050, that could rise to more than 1.1 trillion. So again, it is affecting everyone, whether you have it, whether you know someone who has it, there's someone in your community that's living with a diagnosis. It is affecting everyone. Sorry, ladies, Alzheimer's disease and related dementia affects women more than men. So there's one of those predispositions that we can't change that. So that's why we have to look at our health. It also, African Americans are 2 times as likely to develop Alzheimer's disease and related dementia, while Hispanics are 1.5 times as likely. So again, that's something you cannot control. So if you can control some of the other things, so your brain health, your physical health, your cognitive health, different things like that, if you can make a difference with some of those, maybe that will help reduce that risk. Alzheimer's disease and related dementia in Tennessee. In 2020, it was stated that there was about 120,000 older Tennesseans that were living with dementia. That number is likely greatly higher by now. Again, it's not to say that Tennesseans have just become unhealthy. We are just starting to, there's a lot of research being done, and so it's starting to be diagnosed a little more. So we actually know what's going on with people. And these are people who are not living in nursing facilities or assisted livings. They're still living at home with their families, with a care partner, with a friend. So it's impacting everyone. Again, at some point you'll come in contact with someone who is either living with a diagnosis or is taking care of someone or has been affected by it. So care partners, you're hearing me say that and you're like, what's a care partner? So anybody who provides care is considered a care partner. There has been a shift in the term from caregiver to care partner because people who are caring for someone with dementia, they're a partner on the journey. They're more than just somebody there to make sure they have food, help them get dressed, give them a bath. They're a partner on the journey, especially if it's a spouse. So the term care partner is slowly starting to transition to take over the place of caregiver. It's still hard. I still do it a lot. I still say caregiver a lot because that's what I'm used to doing. But care partner has become the more preferred term. So dementia care partners they face many challenges as well. So they have higher stress levels. They have greater chance of depression. They themselves have poor health because they don't take care of their health because they're taking care of the person they're caring for. And then there's the financial stress of maybe they have to quit their job to care for their loved one. So there's a lot that a care partner has to go through. So if you are a care partner, the analogy I like to use is when you get on an airplane and the stewardess says, please, if the oxygen masks fall, please put your oxygen mask on first before helping the person next to you. That's because if you're not getting oxygen, you can't help the person next to you. So if you're a care partner, take care of yourself. It's not selfish because you are not going to be any good to the person living with a diagnosis if you're not taking care of yourself. So make sure you put your oxygen mask on first before you try to help somebody else and pay attention to yourself. So some communication techniques, we're going to go through these kind of quickly. I know we're getting late on time. As dementia progresses, how a person engages in communication changes, and it may become more difficult for them to effectively communicate. So some things to keep in mind is don't jump around in the conversation. Try to keep it pretty simple, yes and no questions, because the fewer decisions that someone living with a diagnosis has to make, the better off. You may have to re-explain who you are. You're their care partner, you're a nurse, you're a social worker, you're their pastor, whatever that might be. You may have to re-explain it because again, that recognition of people, they may not put the two and two together. So you're just being there to remind them of who you are. Again, simple questions, close-ended types of questions, yes and no. Instead of just saying, what do you want to drink? You may want to say, do you want apple juice or orange juice? Because if you just say, what do you want to drink? They may not be able to form the words to tell you what they want. But if you ask specifically, do you want apple juice or orange juice? That's easy for them to make that decision. And it's not open-ended. Be patient and don't try to fill the space with talking. Just be in the moment. Give them time to respond. They may be a little slower with responding to questions and different things, and just meet them where they're at and try not to speak for them. It's not going to help you or them, and they just might become agitated a little bit more. So again, in the early stages, you might notice they're having difficulty finding the right words. It's taking them a little bit longer. They might struggle with the decision making. They might react a little more emotionally, so cry and get upset a little more because they're still early enough in the stage that they understand things, but they're progressing into the point where it's frustrating because they can't come up with the words. So it affects them emotionally. They get frustrated. It makes them angry. And if you as a care partner are like, oh, come on, hurry up, we need to get this done. They're trying. It's just going to be a little bit harder for them. So just be patient. Let them know you're having difficulty understanding if you're not understanding what they're trying to say. Maybe go to writing it down. Keep your sentences short and clear. And again, leave time for just conversation. Sit down and talk to them. Ask them about different things. Talk to them about things but from their childhood, because you don't just want to rush in as a care partner and do whatever you got to do and leave, because then that leaves the person living with a diagnosis to feel like, well, they're only here because they have to be. Leave time for conversation. Enjoy being around someone and talking to them. As we start to progress, again, you might notice they're repeating themselves more often. Notice that they're maybe not following along with the conversation. They may withdraw completely because they're having trouble with the words. So if they're repeating themselves, don't try to correct them. Just follow along and be patient. Be sure that you're listening to them and not just listening to respond. Again, show you're engaged and just be there to listen to them, offer reassurance. If you notice they're getting frustrated, be like, it's okay. We've got time. Let's just take our time. Just slow down. It's okay. Again, maintain eye contact, make them feel important. Because again, they're trying as best they can. There's physical changes that are keeping them from doing what they need to do. And then as we get into the late stages, talking may become non-existent. They may become nonverbal altogether. But just because they're not talking doesn't mean that they're not understanding or they can't communicate. They will start showing nonverbal cues. Maybe they wince a little if you move them too hard or something like that. So read into those nonverbal cues. They still have emotions and preferences, and they're trying to communicate the best way they know how. So make sure you stay engaged, treat them with dignity and respect, and do not rush them. Again, be patient and just meet them where they are. And definitely, definitely do not try to answer for them or fill the space. So we've just talked about all of these things that happens to a person living with a diagnosis. The care partner is going through this as well. So when you're communicating with a care partner, keep that in mind. Think about the whole picture. The big change for them, as well as typically more stressful, again, because they're trying to figure out how to navigate this. They may need more assistance and understanding than the person living with the diagnosis, because they're the ones that are having to be there every day and go through it and figure things out. So be engaged, listen, be patient, and then just celebrate the small things. You never know how your niceness or how your kindness is going to affect somebody. So always know that you can make such an impact on somebody's day just by being kind. So again, try to be patient. Just let them talk, let them be there and listen to them. So some resources that may be useful for you or someone you know. Alzheimer's Association. So they have a 24/7 helpline. They have support groups. They have community resource finders. So you can go in and type your community zip code and find out resources that are local. They have a thing called All's Connected. So it's a message board for care partners as well as people living with a diagnosis. So be sure to check that out. You can go on and find if there's different trials that are happening, different things that are going on, if you want to be considered for a trial or a study. So Alzheimer's Association has a ton of resources out there available, a lot of statistics and information. Alzheimer's Tennessee is a group that's specifically local here in Tennessee. They have a 24/7 helpline. They have memory cafes. They do support groups. They do care consultations. They have a library of videos that you can watch that is full of support and assistance for care partners. Again, there's support groups for care partners. So there's a lot of things out there on Alzheimer's Tennessee as well. Here at the Commission on Aging and Disability, we have caregiver tip sheets. So there's 18 different tip sheets that break down different things. So medication management, agitation, bathing, different things like that. It kind of gives some tips and different things to do. They're available in both Spanish and English. You can go to our website and download them, or if you want to shoot me an email, I'm happy to email them to you or print them off and mail them to you. But we also have a state of aging report. So that breaks down every county within the state of Tennessee, all 95, and it gives you statistics on the county. So how many people in that county are over the age of 60? How many people have a car? How many grandparents are raising grandchildren? So it's just some good community information that you might find helpful. The Tennessee Department of Health also has an Alzheimer's resource guide. So they break down each county by diseases. So again, how many people in that county have Alzheimer's and dementia that they know of, different statistics like that. Mental health resources. So there's a statewide crisis phone line and a text line. There's 24/7 support. And then there's the Suicide Prevention Network. It's a statewide organization that provides resources for care partners and for individuals just within the community. So those are some good resources to look at. Other things is the getpalliativecare.org is a blog of how palliative care teams can help care partners. There's also a link for handouts, so for families and care partners. So if you're interested in that, again, Alzheimer's Association, Alzheimer's Tennessee, the National Institute on Aging, they have a lot of Alzheimer's and dementia resources for professionals. So if you're a nurse or a social worker or anything like that, you can look at there for some different webinars and different things. And then again, here at TCAD, we do trainings. We do trainings like this. I can do them. That's me. I'm the dementia service coordinator. So we can do them in person. We can do them virtual like this. If you have a group that you want me to come and talk to, we can do that and get you some resources and different things there. Self-care. If you are someone working with an individual who has dementia or a care partner, again, like we talked about, it can be stressful. Pay attention to yourself. Again, put your oxygen mask on first. Your well-being is their well-being is dependent on your well-being, and your well-being is dependent on your self-care. So be intentional. Do maybe some meditative deep breathing. Do exercise. Again, celebrate the small things, guided meditation. Just be aware of what's going on and ask for help. It's okay to ask for help. You're not being selfish. And small things are successes, so be sure to celebrate all the wins. I have given you a lot of information. If anybody has any questions, you can feel free to unmute yourself, or you can type in the chat box and we can go through questions. I'm going to put my information up on the screen. So again, feel free to reach out to me if you need any help with trainings or anything like that. And so yeah, does anybody have any questions, comments, concerns, anything like that? Okay. Well, I guess if we don't have any questions or anything, I'm going to put the link for the, oh wait, Sydney said they're not able to unmute. Hang on, let me see if I can unmute. Okay, can anybody unmute now? Yes, no? Okay, well, I'm sorry, I don't know how to get the setting to change. But okay, thanks, Sydney. I'll have to figure it out. So, but I put the link for the post pre or post eval in the chat, and I'll also email it out. If anybody needs it, then just let me know. And this is being recorded, and again, it will be put on the TCAD YouTube channel. So I'll be sharing that link with everybody that registered. So we have that information out there for you, so you can watch it again. And again, if you need me for anything, feel free to reach out to me. And I'm going to stop the recording. And